I'm Dr. Gay Carlson, President of the American Academy of Child and Adolescent Psychiatry, here with another of my SCREENSIDE chats for our AACAP members. SCREENSIDE chats, as some of you know, are meant to share timely clinical practice and other information from experts on key topics during this COVID-19 pandemic now confronting us. Reminiscent of President Roosevelt's fireside chats during the Great Depression and World War II, I'm hoping they'll be informative and comfortable and fill a niche not addressed by materials otherwise available. With us today is Dr. Jill Cioffi. She's Medical Director of Ambulatory Primary Care Pediatrics at Stony Brook Children's Hospital, which is part of Renaissance School of Medicine here at Stony Brook. She's one of my colleagues, in other words. She's been doing this job for the past 7 years. She's been a primary care pediatrician for over 23 years, both in private practice and more recently in academia, where she's Assistant Professor of Clinical Pediatrics. Her other major credential is she's mother of 4 school-age children. Hats off to you on that one, Jill. I asked her to chat with me today because I was incredibly impressed with how well she was able to manage pediatrics here at Stony Brook through the worst of the COVID assault that we had last spring and summer. As some of you know, I'm on Long Island, and New York and Long Island were especially badly hit by COVID last year, or not last year, last spring. We were on a panel together to help people in schools go back to school and provide advice. And some of what she had to say I thought was very useful, and so I asked her to join me today. So, Jill, to start, what are the broad lessons you learned as a pediatrician so far during this unprecedented time?
Good morning. Thanks for having me. I have learned a lot, actually. I think the first thing that I learned was that I actually was a physician, because you sort of wake up every morning and do the same job, and then something that you really couldn't even have dreamed about starts to happen, which is a pandemic. And being, like you said, one of the first areas that was affected was incredibly challenging on so many levels, both professionally and personally. So I have learned a lot about what I signed up to do a long time ago. I have learned how to have different names be given to me, such as essential worker, which, who's ever heard that term for a pediatrician? So, being called an essential worker was something that I had to come to grips with. Also, being called a hero, which to me is still a very uncomfortable term. And I don't think even during that time, many people wanted to be a hero. It sort of connected me to my ancestors who had to deal with the world wars and had to go off. And it sort of taught me how to rise up and to just stay present when I was really fearful. So those are my broad lessons, both as a person and as a pediatrician. I also think that a lot of us in the medical field never thought we would see a pandemic. I think we thought it was the thing of movies. And I think that we also, even when we were witnessing it in China, it felt very remote. And I think that when it started happening to us, it was, although frightening, it really let us sort of lean on the skills that we had been gathering for however many years we were doing our profession. So I found a lot of strength in some of the skill set that I had being a doctor.
So basically what you're saying is you kind of woke up and said, oh my God, this is me. I've got to get my act together. But wait a minute, I've been trained to do this. Maybe I can do this. Oh, okay, I can do this. I mean, that's the feeling I'm getting from you. Is that kind of how it evolved?
Yeah, because, a lot of the stuff we had learned, even in medical school, we knew how to scrub in and scrub out of an OR, right? We remember those OR nurses who nitpicked how we put our gloves on and took off our gowns. And, we had been taught how to do this. But as pediatricians and as an ambulatory pediatrician, meaning I was not a hospitalist, I wasn't working in a hospital, I hadn't put on sterile head to toe gowns in a very long time, but I had done it before.
Mhm.
And so I think it was sort of leaning on our past experiences that was very helpful.
Well, I think actually in child psychiatry, at least the younger folks, I'm one of the vulnerable ones for reasons that we will leave unmentioned for the moment. But for the younger folks and the house staff and so forth, they really did rise to the occasion, and it was impressive. What do you think this has had? What's been the major impact on kids' health at this point, or even on your colleagues' health?
So, I mean, I think that that's the other part of this pandemic that was so surprising to us, and one that we really couldn't fully read from looking at China, is that this wasn't a pediatric disease. So I think even, although I definitely felt like an essential worker and I went off to work every day, I didn't feel like a hero because I really wasn't dealing with the worst of this pandemic. This pandemic is very surprising to the medical community because it did not affect children disproportionately. So we were really the lucky group. And as you know, pediatrics is sort of the less, sometimes the least respected in terms of academia, but we were really the group that was able to have patients that were relatively spared this illness, which is, I think, again, unprecedented and has been, I'm very grateful for it because not only did we have to deal with the illness, but we didn't have to have our patients and the patient's parents so upset by the outcome. So I really feel very grateful for that. So I think pediatrics dodged a bullet on this one. And I think we're all incredibly grateful. I hope it's not a warm up for things to come because this is not very consistent. Coronaviruses have existed for a long time, and coronaviruses do exist within the pediatric population. I think the pediatricians pretty much get exposed to it yearly. So I think that for pediatrics, this was a very kind pandemic. Can you repeat the other part of your question?
Well, that's fine. So, but you're also saying you're sort of halfway waiting for the other shoe to drop. You're not sure what's going to come back around. And certainly in listening to all the various podcasts that I listen to, you know, there are concerns. Are children carriers? Are they, is that, I can't think of the name of it, but that horrible disease that,
Yeah.
A dozen or so kids, have died from. Is that going to turn out to become more of a problem? But I think the impact, the other end impact on kids is the fact that people are now afraid of them. I mean, I don't know how else to conceive of it because of school opening, right? And so I think that that's where you and I got to meet. But what are your thoughts at this point about school reopening? Is this a disaster waiting to happen? Are people hyped over things that they needn't be hyped about? What are your thoughts at this point?
I think I'd like to temper my thoughts that it's a slice of time right now. So the good news for me is that schools have reopened, and they have reopened starting in August. Definitely different parts of the country reopened sooner. I think we're seeing the same pattern, which is that people are going to get infected, but we're not seeing the rates of hospitalizations go up in those communities. So although people are afraid of children, I don't really think that that's a fair assessment. I think that what people should be afraid of are groups of people, because if you look in New York right now, and how I explain to my own children is that if you have a 1% infectivity rate currently, that means 1 out of every 100 people, whether you know it or not, has COVID. So it's not that it's children per se that are carriers or children per se that we should be afraid of, but it's that 100-person grouping. So school, right? So school is a lot of 100 groups, right? And there's a lot of them. And so what we saw was early on, some of the really large colleges, when they went to open up, if they didn't have a very good grip on their population and they couldn't keep them from social distancing, mask wearing, and doing the proper things, they very quickly learned that 1 out of 100 became something different than that, because everyone in that room could get infected by that one. So I think that that's what we saw repetitively, and I'm feeling that it depends on how you look at the word disaster. So if you look at the word disaster, that our incidence is going to go up, then there's a little bit of a disaster happening, right? So you put 100 people together, one person has it, and chances are they're going to infect somebody else, and that could have a domino effect. But if you look at it the other direction, that schools have been able to reopen, there's colleges that have successfully reopened, there's public schools, private schools. We're really not at the first week, we're at least a month in, and some have been doing really great. So I look at it as a success, but I would say that the virus is behaving exactly how we expected it to, which is that if you get into large groupings, you are going to see people get infected.
Do you think, I mean, so we both live in New York. I'm sure you listen to the news same way I do. It seems to me that there's a lot of concern in New York City about reopening schools. They have not reopened. We have on Long Island, we have mixtures, and I think this is true for all over the country. You have virtual and in-person, and they've got it divided up and so forth. It's certainly nowhere near normal, but it's better than everybody's on lockdown. What's going on that people are as concerned as they are? Is it the other adults they're concerned about? Is it the kids they're concerned about? What's the issue?
You know, I think that it's hard for me to speak specifically about New York City, but it is a pattern that I saw locally before the schools reopened. I think we saw it nationally in terms of your news feeds as to all the teachers that were very upset about having to do either or both at the same time, a hybrid model of having to be a Zoom teacher or having to be in person and potentially get exposed. I think New York City is still grappling with some of those issues. I also think that they don't have busing system the same way we do, and they've been relying on public transportation. So if you can imagine that 100 gathering that I was just discussing, that 100 could mean a subway car, and those are not a cohort, so you can't control it. So New York City, I think, has very unique problems to themselves that I think are going to be very challenging. It's very population dense, obviously, and they have the transportation to schools. But I wanted to just circle back to one thing, because what the other interesting thing for me about this pandemic has really been that there's two separate entities. There's the pandemic itself, which we know is not affecting children in a way that is causing much what we, medicine called morbidity and mortality, right? It's not causing a lot of long-term effects nor a lot of deaths. But what ended up happening affecting children, and potentially globally, we'll find this eventually, is really it's the lockdown measures and it's the other things that we're doing to mitigate getting the virus that is causing the biggest effect. So that's why I met you, right? We did school reopenings and we did a lot of focus on what happens to the vulnerable populations, what happens to the non-vulnerable populations, just the average kid who maybe is becoming more and more socially phobic or becoming more anxious. How do you break those when everyone's in a lockdown? What does school provide beyond the education part? I think we've proven that school can do some schooling remotely, and my own children being of a little bit older age have benefited from that. And I feel like there is some success story in there. But what we can't not look at in this pandemic is what have we done to prevent it from happening, and what are those ripple effects? And those, unlike the disease itself, I think those are disproportionately affecting children. And so for me as a pediatrician, that's what I focus on when I try to get everyone back into school.
So you're trying to mitigate the psychological harms and the developmental harms, for lack of any better term, that I think everybody's aware of, and you really become, well, I think some of the things that have come out of it is I think parents have gotten a new respect for teachers.
Sure.
I think the society has gotten a new respect for just how integral schools are in terms of feeding the population, not just educating them, but providing a place for them, a safe place for them to be when their parents are at work. I mean, we really depend on schools to be everything. I think that's really what has been brought home. It is just not a place where you go and learn how to read and write and do arithmetic. So you have 4 kids, if I might ask. How old are they?
So my oldest is 17. He's a senior. And then I have a 16-year-old daughter who's a junior. I have a 14-year-old daughter who's a freshman. And then I have a 12-year-old son who's a 7th grader.
Okay, so you've got the adolescent end on that. So that's particularly challenging, I think, isn't it? Because those are the kids that aren't necessarily following the rules or are, saying, why should I worry about this? How have you handled that?
So I have a little bit of everything in my house. I have definitely a person who's very afraid and socially withdrawn. And then I have the sort of flagrant non-social distance, not mask wearing, not understanding 16-year-old as well. And I think that, what I try to do is I try to prioritize what's important. So I say to them, nothing has really changed. We have a pandemic going on, but what I've always cared about was your behavior, how you behave in society as a societal citizen, and also your education. So how are we going to focus on those 2 things while this is going on? It doesn't mean that I get exactly the same response from all 4 of my kids, but I do try to have them make decisions. So for example, for my children who don't feel like they can social distance and don't feel that that is something that is applicable to them, then they aren't allowed necessarily to see the grandparents, or they're not allowed to go around other vulnerable people, or they have to wear a mask more often, and they're not allowed to jump into my bed and snuggle. So I really just say, okay, these are your choices, and these are the consequences of what these choices are for you right now. But I try to do it in a loving way. I mean, this is a very unprecedented time, and because the kids are not getting super sick, they're not getting immediate feedback as to, how dire the consequences are for spreading this virus.
Yeah, that was what I was trying to get. I did an interview for the other day, and I was trying to get the reporter to understand that, and this is not unique to children. This is true for everybody. Most people need immediate feedback. I mean, there's all sorts of data that say most people would rather take $1 now than $5 in a week or something, to that effect. Yeah. We need the immediate feedback. And if you don't drop dead on the spot, or, at least within 2 or 3 days, it's down the road a piece. And if it's a problem that it might affect somebody that you don't know, well, even that, I mean, as vicious as the virus is, it doesn't affect everybody all the time. So, you can see grandpa and grandpa will be fine. And then you'll say, well, then what's the big deal here? Grandpa was okay. They're just, they're unnecessarily worrying. So I think the whole nature of the fact that we're talking about an incubation period that goes on for a long time, the fact that the penetrance of the disease is variable, I think it does make it difficult to get people to change their behavior on the basis of what it might do. But that said, we need to do that because that's basically what we've got is mitigation strategies. Have you found, by the way, any discussion amongst your patients of vaccines? I mean, are they getting the measles, mumps, and rubella vaccines? I mean, are they getting the vaccines they're supposed to be getting, let alone worrying about down the road if they're going to get a COVID vaccine?
So what they found was during the beginning of the lockdown that so many offices had chosen to close because that was their, we were having trouble getting really PPE, right? So I am not blaming those decisions. It was a very difficult time. We were really lucky to be part of Stony Brook and we were really prepared. because of the measles scare about a year and a half ago. So
Right.
we all had N95s that we had already been tested for, and we had some PPE. So we stayed open. You know, I'm really certainly very proud of it. It was incredibly difficult, and we didn't at that point know that it wasn't going to affect pediatrics, but we stayed open. And we, before the American Academy of Pediatrics said 2 years and younger should still come in, we had picked 15 months because that's when most of the vaccines are done. So we actually had an increased rate of immunizations during the pandemic, which is just really remarkable, and I'm certainly very happy about. But across New York State and across the country, they did see a fall in immunization. So that is something that was expected, because if you're not open and if you aren't seeing patients, they're not going to get immunized. I really have seen certainly what we used to call the COVID grateful patient, that everyone was so happy we were there and everyone was coming in, and a lot of people wanted their vaccine. So we saw that in the beginning. I do get a lot of questions now about the vaccine coming out. And I actually went to get my own flu shot, and it was at Stony Brook, and the person who was giving me the flu shot was like, well, you're going to get the COVID vaccine if it comes out. And I'm thinking, yeah, because, you know, I don't want to get COVID. And if there's a vaccine, I believe in doing my best to prepare my body and my community from not getting it. So, but my patients are asking, and I would say that it's unfortunate that I don't think we're ahead of this argument out in the media either. So I think that's going to be something that's another hurdle that we have to face. But I think maybe if the medical community goes first, that may give them some confidence. And so I believe that's the strategy that we're going to probably roll out. I keep hearing that they're going to prioritize people seeing COVID patients first. So maybe that will give the rest of the community confidence in it. But I think it's going to be a hurdle. I really do.
Well, I think just the actual delivery of at least everything I've read suggests that this isn't, you know, a shoebox full of injections pulls up at your local, CVS or whatever your drugstore is, and, you know, somebody just bops in and gets their shot. I think you may need a couple of shots. I think you're going to have to overcome the concern people have about vaccines anyway. We've got the fact that the politics has not increased people's confidence in how they're doing it. But just because you're dealing with people who, I mean, you've got a bunch of things for which we've got known, proven vaccines, and it concerns me when people don't take advantage of that.
Yeah.
And I'm glad to hear that wasn't such a big problem locally.
Yeah, no, it was actually, we've been helped out by the New York State mandates. And I think what we saw was a lot of people waiting to see if schools were going to reopen. And I actually had a mom call me last week where they were going to even cut off the virtual learning if she didn't comply with the vaccine. So she had chosen the at-home option, but they were still enforcing vaccine records, which is great. You know, as a pediatrician, you always want to keep your eye really on what's going on. And that's why I said, you know, for this pandemic, it's been so interesting because we're definitely, as a group of colleagues, we're very committed to keeping ourselves safe and then our families safe, because we obviously go home to our children and our significant others. But beyond that, we really also have to make sure that we realize that the other vaccines are more important at this moment in time for our patient population, because those diseases, we know how they affect kids. This one is really proving, again, it's not innocent in children, but it's certainly not what the adults are facing.
So we've said that you kept ambulatory pediatrics was open during this whole thing. What did that look like? How geared up were you in terms of the clothes and people sitting out in the car and so forth and so on? Tell me how that looked.
You got it all right. we look, and it's been a work in progress. We are a little bit unrecognizable. The clothing that you see on me today, I haven't worn for a very long time.
Me too.
Pediatricians now wear scrubs, which is, again, what we used to see in the OR, but we started mimicking those people, because if we had to put it on, sterile clothing and keep ourselves safe, the best thing to wash every single day were scrubs. So a lot of us are in scrubs. We definitely wear face masks. We do not wear N95s unless we're dealing with COVID patients. I'm also happy to say that those are the things that when you make those decisions, they're so scary. And certainly as a medical director, they were scary for me to make and be confident in. But once you get a few months and few weeks under your belt, you start to realize that your policies are working and your procedures are working. So we have face shields. Even if we wear glasses, we wear face masks, not the cloth type. We wear the surgical mask. And then if we're arriving everyone from the parking lot. If people are taking public transportation, we obviously let them use our waiting rooms. But in general, people want to wait in the cars. We bring them into the rooms and bring them out. It's different. It's definitely different. But we've gained confidence working through this. That was the other thing that I wanted to mention, is that the colleagues of mine who went out and in the beginning were willing to use our best practices from medical school and from residency, where we remembered how to put on sterile gowns and protect ourselves. Those of us who continued to work through the pandemic, the rewards as we moved forward were really measurable in that we had confidence we could keep ourselves safe. Like I can tell you 2 weeks ago, I personally swabbed a COVID patient and the person came back positive a few days later, but I'm still sitting here nice and healthy. So that brings confidence. And that's what when we were doing our school reopening webinar, I kept saying, once the schools start, they just need to get a few weeks, a few months under their belt and feel confident that what they've put into place is going to help protect them. And once they get that protection, they're going to feel good about what they've done.
Has it made a difference whether you're dealing with a new patient or a kid that you've seen before? I think one of the things that, and this is sort of maybe a positive or a closing thing. People have all been thrilled at how well telemedicine works. And you're telling me that you're using in person, not telemedicine. But one of the things that helps is if you know the person, you can do things remotely. If you know the person, you can come in looking like somebody that just landed from outer space, and at least they know that's Dr. Cioffi under them, right?
That's right. Yeah.
But if you don't know the person and this thing comes out looking like a large insect with goggles and masks and, so forth and so on, isn't that terrifying for little kids that don't know you?
So I have two responses to that. The first thing is pediatrics. Again, look how great our profession is. I take care of kids from the time that they're born till I have to sometimes pry them out of my practice when they go to college at their, finishing college. We see till 21. So that definitely puts us ahead of the game. When you walk into the room, I've had patients actually start to laugh at me because they know it's me, but I'm pretty covered up. So I say, yeah, this is my Halloween costume. And, I'm a little early this year, but so my patients have been, and they're different looking too, right? Because they're in masks too.
Right.
But the other part that me and my colleagues talk about all the time is that here we are in all this gear and we have babies, right? We have infants, we have 2-month-olds, and typically we engage with them because it's part of our exam to see that they are developmentally normal. They can make a social gaze, they can coo. We could be covered head to toe, only our eyes barely showing because I have glasses plus a shield. And just by my voice, I can see their face start to smile back because infants don't wear masks. Mm-hmm. So we're engaging with them in a hazmat suit essentially, and they're picking up on it. So the social cues that they pick up on is also incredibly remarkable to see. And all of my colleagues and I have recognized that. So yes, we're certainly scary, but the infants don't think so. And our patients who know us underneath that also definitely recognize there must be something emanating, is what I'm saying, even to our normal patients that they're picking up on. And we're all in this together, right? So I think that's what it is that we all really do still need to be together. That's why school reopening was so important to me, and why it's also important to continue to be a pediatrician, because they really want that. And I get a lot of reward out of that.
I guess I must be socially retarded because I had gone to a medical appointment, and person picked me up, took me to the room, was talking to me and so forth. And I was thinking, gee, I wonder where Dr. Kleinfeld is. And the conversation continued. After about 3 minutes, I realized, oh my God, that's Dr. Kleinfeld. I don't see her that often, and I must, there was something about her voice that didn't even sound familiar. Anyway, it was pretty funny. I didn't let on to her. I didn't know who the heck it was that she was.
Well, maybe that's happening to my patients too. I don't know. They all seem to be they're all being very nice. So
okay, at least they're not running out of there. All right. So I think we can end on that kind of funny, positive note. I think that I think we're all sober about the fact that we've got some challenges ahead with the confluence of flu and COVID, and just being able to detect the difference between a runny nose and a cough because you've got an old-fashioned URI, and oh my God, is it COVID?
That's right.
I think that this is definitely a memorable time, but I appreciate you, Jill. I appreciate pediatrics. I appreciate the positive outlook that you have on this. I think it's really important for people's morale to understand that that we've got the experience and that we can cope.
Yes, we do. Yes.
So thank you.
Thank you.
And thank you, our listeners from AACAP. Thank you all very much for tuning in. This is Gay Carlson for AACAP's Screenside Chats.